I've been associated with Dr. Sharan Srinivasan for the last 5 years. We've been doing various type of surgery for both for dystonia, Parkinson's, and along with the rehabilitation programming workup. We have done quite a couple of Parkinson's patients with the bilateral lesionectomy surgery, and most of them get benefited following this bilateral surgery. And also we have done DBS also. A few of them are doing well now. I mean, initially we need to select the patients properly. Those who are really going to benefit, such patients should be selected and subject to surgery. In dystonia also we have done large number of cases. For example, focal dystonia, writer's cramp, cervical dystonia, and hemidystonia. As per our assessment and follow-up, we have noticed 70 to 80% improvement in certain group of patients. Of course, there for any surgery, there is some amount of failure will be there, which has to be accepted despite so much care has been taken for them. The awake surgery we did 3.5 years back. The patients with task-specific dystonia occurring while playing guitar. He's a professional guitar. He has been having this problem for many years. He has gone to different places, and also he has received botulinum toxin. But following a surgery done in our center, so-called VOA thalamotomy, he was immensely benefited, and he went back to his professional guitar program, and he has given a couple of concerts on music by his professional activities. Challenge is that initially the patient has to be convinced, and the patient selection is important. Their acceptance, their consent, then the type of surgery we have to decide. This sometimes is a tough task. Then evaluation, pre-surgical evaluation, applying various scales. Then we are involved in the OT also as well, along with the neurosurgeons. OT during surgery we have to assess the various signs and symptoms, any side effects profile one can come across. We have to look into it. And then after the surgery, imaging of the brain to look for any bleeding or any abnormal signals catching up following surgery. Then later on, a medicines adjustment and rehabilitation program to be started. So it's a quite Herculean task. One has to mentally prepared to take up this challenge. Lesioning is a small hole burn done in the brain, precisely in a particular spot. DBS is nothing but pacemaker attached to the chest, and wire is passed to the brain and constantly stimulating through battery oriented pacemakers, which is very costly procedure, DBS, whereas the lesionectomy is a low profile, financially low category of surgeries. Usually it can be done those patients who are having a predominantly one side signs and symptoms, not progressing to other side of the body. And number two, those who are financially cannot afford DBS, such patients can be given options of treating with lesionectomy. Some of them can be revert back to the to the reasonable normal state of condition, but it requires a lot of Herculean task, in the sense a lot of patience and lot of challenges one has to come across, because it may be it's a long duration, means more than 6 months, 1 year sometimes. We have seen a couple of patients who do well following long-term aggressive rehabilitation programming exercises.
Okay, sir.